Hi friends, good morning. Today we are going to see the guidelines for making the prioritization. Here we are going to discuss about a question to see a scenario how we have to choose the correct answer and eliminate the other distractors. So the question goes, the client diagnosed with peptic ulcer, a disease has blood pressure of 88/42, an apical pulse of 132 and respiratory rate are 28. The nurse writes the nursing diagnosis, altered tissue perfusion related to decreased circulatory volume. Which intervention should the nurse implement first? Here we have to analyze the question. What are the important aspects they have been mentioned in the question? Like they have mentioned the BP, the apical pulse. The BP is on the lower side, the apical pulse is on the higher side, and the respiratory rate is somewhat also high. And the diagnosis also been given. It is related to the tissue perfusion decreased and decreased circulatory volume. So already the assessment has been done in the question. Now we can see the options. I will walk through the options. That is, notify the laboratory to draw a type 1 cross match, assess the client's abdomen for tenderness, insert a 18 gauge catheter and infuse lactated ringers, check the client's pulse oximeter reading. So we have to choose the correct answer among these four options. So according to the question, already the assessment has been done. In seeing the patient condition, we would like to select the option 3. That is, we have to insert an 18 gauge catheter and infuse the ringer lactate solution so as to rehydrate the patient and supplement the circulatory volume. Now I will walk you through other options, why these options are not correct. The first one, which says that notify the laboratory to draw and type cross match. Yes, this is very important, but it takes a quite lot of time to draw a sample, to get a cross match and get the reports and appropriate. So in this meanwhile of time, the immediate appropriate intervention has to be implemented so as to save the patient's life, and the rest of the things can be go hand in hand parallel. So meanwhile we can give the IV fluids and support the patient, and parallelly we can get all the investigation which is supporting for the patient's treatment. And next option is assess the client's abdomen for tenderness. Already the question has been indicated, the assessment is already done, with the basic parameters is already being mentioned with BP, pulse and respiration, and the diagnosis is also been made. Again, we don't want to go and do the assessment again, because this is also a type of distractors we have to eliminate. And as I said earlier, third option, which is 18 gauge catheter and infused ringer lactate, this is the correct answer, because we are supplementing the IV fluids and maintaining the patient's hydration status and supporting the circulatory volume where the patient will recover. And the next option, why it is incorrect, is check the patient's pulse oximetry reading. This is not required at this point of time, as it is already been indicated the blood pressure is on the lower side. The circulatory volume has to be supported, so this comes in the priority when compared to the respiratory status, right? Okay, thank you.